Welcome to GSBS Medical Trust Health Channel. Here we share the information about healthcare and treatment. In today's session, we are going to discuss PCOS, Polycystic Ovary Syndrome. For today's session, we have invited our panel doctor, Dr. Deepali Prabhat. She is a gynecologist having experience more than 25 years. So, welcome, Dr. Deepali. Okay. So, my first question is, what is PCOS?
Polycystic ovary syndrome is a common condition seen in the reproductive age group of 15 to 55 years. It's seen almost in 8 to 16% of this population, and unfortunately 70% of the women don't know about it. So it remains undiagnosed, and so it's a real big public health problem.
So, doctor, what causes PCOS?
So exact etiology is still unknown, but definitely it is going to be multifactorial, because there is a genetic predisposition and it is seen to run in families. But a faulty lifestyle is a major factor. Biochemically, what we see is there is hyperandrogenemia or excessive male hormone level, and hyperinsulinemia or insulin resistance, which gives rise to the metabolic problems.
And what are the symptoms, doctor, of PCOS?
Yeah, so PCOS normally starts around the age of puberty and commonly presents with irregular menstrual cycles. Sometimes there are other hormonal problems like acne, excessive hair growth, either on the face or other parts of the body. There may be hair fall occasionally in some women, which is also called as alopecia. Some women may present with weight gain or difficulty in losing weight. Sometimes women present with psychological features like anxiety, depression, body image issues. And long term, basically, it can cause metabolic problems like obesity, increased blood pressure, impaired glucose tolerance, pre-diabetes, diabetes, and in long run it can also give rise to cancer. In women who want to conceive, sometimes they may have difficulty, so it is related to infertility as well. And women who become pregnant, it can cause pregnancy complications. So all these could be the signs and symptoms.
So, doctor, how to diagnose this condition early?
So PCOS, we follow the Rotterdam criteria, which is 2 out of any 3 features. The first feature is of ovulatory dysfunction, that is irregular cycles. The second is either clinical or biochemical hyperandrogenism, which means that either you see these effects of excessive male hormones like excessive hair growth, or it could be seen in the blood results where you see excessive levels of testosterone hormone. And the third criterion is a polycystic ovarian morphology on ultrasonography. So when we do these tests, we come to the exact diagnosis of PCOS.
So, this condition, is this reversible, and what is the treatment of this?
So, as I already said, this is like we don't know exact etiology. So, we can definitely keep the signs and symptoms in control and reverse all of that. So, that is maximum that we can do, and the treatment is multi-component and mainly based on lifestyle changes. So balanced nutrition, regular exercise program, behavioral strategies to regulate sleep, manage stress, these play a big role in the management of this condition. For symptomatic management of irregular cycles, we can use hormonal preparations. So also for fertility treatment, we can use ovulation inducing agents. If there is impaired glucose tolerance or diabetes, we use insulin sensitizing agents. So all these pharmacological treatments can be done for the symptoms or the signs that are seen. We have a lot of dermatological treatments as well available. But the mainstay is going to be lifestyle changes to keep this condition under control and also prevent the long-term consequences on the health, which are the more dangerous things.
GSBS Medical Trust has designed an exclusive virtual program for PCOS with the objective of providing a knowledge on all aspects of this disorder. This program is designed in a course format and 6 instructors are experienced specialists in their respective field. The instructors include gynecologist, an endocrinologist, a dermatologist, a nutritionist, a psychologist, and a physiotherapist.
Because this condition really requires a good holistic management, and you have to have the correct information, and you can adapt all this information that you get to not have the complications in the long run.
Thank you, Dr. Deepali, for a very valuable information. So, viewers, if you want to know more about the PCOS clinic, please connect with us. All our information, website details, everything is mentioned below in caption. So, thank you so much for watching this video. Thank you. Thank you, Dr. Deepali. Thank you.
Thank you.